Imaginein mo board exam bukas at hindi mo pa alam ito? Let's study with me! Our topic for today is myocardial infarction. Now, students, as we all know, this is a very high magnitude topic in our med-surg classes. Why? It's because it's one of the most prevalent cases in the Philippines. So, it's important for us to know what is myocardial infarction. Now, let's study this one. So, from the word myocardial, meaning myo, heart, cardial, but what does infarction means? It means that there is death and tissue. And students, from the first year pa lang, what do we call that? Guys, necrosis. So that means there is probable death of tissue or necrosis when there is myocardial infarction. But let's go deeper. Makinig ha. Next is that when it means that when blood flow in heart is blocked. So what happens when blood flow is blocked in the heart? It causes damage, right? Let's proceed to risk factors. Now, ulit na tayo nito, high BP. Patients with high BP, remember that ha? Also, high cholesterol. Now, if you can remember, what is bad cholesterol? I talked about that one in my previous vlog. Guys, what is bad cholesterol? Guys, LDL. Graduating na tayo guys next month. Hindi nyo pa alam, LDL ang bad cholesterol. Because again, HDL has a protective mechanisms to your heart. It carries out LDL away from your blood vessels and carry it back to the liver for it to be excreted. Ha? So ayan yan ha. Bad cholesterol is LDL. And if that's the case, if mataas yan, there could be what? Plaque build up. What we call atherosclerosis. Ha? Yan ha. Next is diabetes mellitus. Your vices. Now, what are the common vices? Vice ganda? No. It means smoking, alcohol, yun. So, next is of course, sedentary lifestyle. Of course, one of the most culprits. Kasi if you don't do exercises, naka-computer ka lang, nakahiga ka lang, you're very prone to these types of diseases. So, it's important to have active lifestyle and healthy lifestyle din. Next is signs and symptoms. Number one, of course, is chest pain. So, we have talked about this one, especially angina. Unstable angina could lead to possible myocardial infarction. So, of course, chest pain feels like someone is squeezing your chest, someone standing on your chest, ganon. And sometimes the pain would radiate to the jaw of the patients, to the teeth, to the left arm, and at the back of the patient. So, it's important to be aware of the characteristic of chest pain for myocardial infarction. Next is SOB. What is SOB? Shortness of breath. Huh? Next is dizziness and a feeling of impending doom. Feels like anxiety where you feel like there's extreme anxiety, bang feeling mo na may mangyayaring masama talaga that you cannot control. That's the feeling of impending doom. Next is diagnostic test. Oh, wait lang guys ha. Signs and symptoms could be different from what? Guys, different from male and female. Because a female that's experiencing myocardial infarction could have a lesser showcasing of symptoms. Sometimes it may not even be that lala. So that's why it's important for us also to be aware na symptoms of myocardial infarction is different from male and female. So important to be aware of that. Diagnostics test is ECG. Of course, blood works. What kind of blood works do you want to do you think will peak here in myocardial infarction? It's cardiac troponin I. But why is it troponin I ang mostly gina-order? It's because it's the most, ano bang tawag dito eh? Siya yung parang pinaka, high indicator of myocardial damage, ha? So, it usually rises. We also have cardiac troponin T, but it could also showcase when there is problems in the kidney kasi. So, that's why high yield talaga si cardiac troponin I alongside with ECG. So most of the time, bine-blend yan silang dalawa to, of course, diagnose myocardial infarction. Next is angiography. This is the type where there is parang gina-insert sa groin ng patients here and then up until to the artery of the heart and see the blockages in imaging. So it will be traced by the healthcare professionals. Now next, we have types of myocardial infarction. Now what are the types? Nabe, ang type ay hindi ka type ng crush mo. So makinig ka dito. Ha? Piliin mo mag-aral, pasayin mo ang board exam, mamaya na yung jowang-jowa. Now, what are the types of myocardial infarction, students? I bet you know this one already. Sa CA classes pa to din i-discuss. Of course, we have STEMI and NSTEMI. Now, what's the difference po ba? So, of course, you have to take a look in the ECG of the patients. Again, to diagnose what kind of myocardial infarction, you have to take note and be aware of the results of ECG. Next, we have STEMI. What does that mean? ST elevated myocardial infarction. So that means, di ba we have ECG, PQRST, the ST elevates. So that means there is what? Severe attack. There is severe attack. So that means the coronary arteries in your heart is totally blocked. So what will happen? Mag-pray na tayo. Why? Because it could be, it's called widowmaker for a reason, literal. Widowmaker, it's because when there is blockage, especially in the biggest artery in the coronary, which is the left anterior descending artery, it could lead to massive fatality. Of course, it's called widowmaker kasi literal na if may asawa ka, magka-heart attack siya, you will be a widow. So that's why it's called widowmaker, literal. So, next is that this is the most highlighted type of heart attack kasi it means complete blockage siya. There's no blood flow to the heart. Next is NSTEMI. This is partial blockage siya. There is ST segment depression or T-wave inversions. So, sa kanilang dalawa, what do you think is the most dangerous situation? Guys, of course, silang dalawa pa rin because there is compromised blood flow to the heart. You cannot pick between the two. Kasi again, there is compromised blood flow to the heart, ha? Remember that. Now, let's go to treatments. So first, of course, is our aim here is to restore perfusion and limit damage to your what? Guys, lamok. Your heart. Ano pa bang pinag-uusapan natin? Heart lang naman. So, of course, O2 therapy tayo. Next is percutaneous coronary intervention. Thrombolytics such as that ends with ACE. Alteplase, streptokinase. Yan ay thrombolytics. It is blood clot buster ba? Yung may clot na binabust niya, dinidissolve niya. So that's what's called thrombolytics. Now, anti-thrombotics. Magkaimbayan silang dalawa ha. Next is we have aspirin and clopidogrel. Anti-thrombotics is it prevents for further clot formation. Okay, so that is the topic of our myocardial infarction. So thank you so much for watching. Again, I'm still a student. I could say some wrong or misleading information here. Now it's important to correlate this one into your own research as well. Thank you so much for watching.